Good afternoon, everyone. Thank you for joining us for today's webinar. Before we begin, I'd just like to pause for a couple of minutes while more people connect, and then we'll go over to some housekeeping regarding our webinar platform. Good afternoon, everyone. Again, thank you for joining us for today's webinar. During the webinar, you'll be able to add questions for our guest speakers via the little drop down in the control panel that says questions. You can pose questions at any time, but they will be answered after the presentations have finished. Your mics and cameras as audience members will remain off for the session. The webinar will be recorded and made available afterwards, as will the presentation materials and other resources. All right, I would like to now formally kick off our presentation this afternoon. My name is Rosalind Dundas. I'm the lead for advocacy at ARACY, the Australian Research Alliance for Children and Youth, and I use she, her pronouns. I would like to begin this event by acknowledging the traditional custodians of the land on which I am meeting from today, the Ngunnawal and Ngambri people. And I recognise that we are all participating from unceded lands across Australia. I pay respects to elders past, present and emerging, and welcome Aboriginal and Torres Strait Islander people who are participating with us today. Today's webinar will consider issues affecting the lives of LGBTIQ+ young people and explore what works to reduce health risks, improve wellbeing, and support young people in any health issues they might face. The webinar is an exciting partnership between ARACY, the Australian Research Alliance for Children and Youth, and LGBTIQ+ Health Australia. And in case you don't know ARACY, we seek to catalyse change by bringing people and knowledge together for the benefit of children and young people in Australia. We strive to achieve this by advocating for evidence-based policy and practice, focusing on prevention and early intervention. And our partners today, LGBTIQ+ Health Australia, is the national peak health organisation in Australia for organisations and individuals that provide health-related programs, services and research focused on lesbian, gay, bisexual, transgender, intersex and queer people and other sexuality, gender and bodily diverse people and communities. Now, as we start, I also want to acknowledge that sometimes these conversations can cause distress. If at any time you do feel distressed, please reach out to Q Life by calling 1800 184 527. Q Life also have a web chat service which can be found by visiting qlife.org.au for more information. But if you are in crisis, please call Lifeline. They're available 24/7 by phoning 131114. You can also access them via web chat on their website at www.lifeline.org.au or texting 0477 13 1114. So, without further ado, let's get on to our conversation. Our first speaker today is Natalie Amos. Nat, who uses the pronouns she, her, is a research fellow with the Australian Research Centre in Sex, Health and Society at La Trobe University. Nat's research centres around LGBTIQ+ health and wellbeing. She's currently working on reporting the outcomes of Australia's largest national surveys of LGBTIQ+ adults, Private Lives 3, and young people, which she's going to speak to us today, the Writing Themselves In number 4 report. Natalie, please go ahead.
Natalie, we just can't hear you at the moment.
How's that? Can you hear me again?
That's good now, thank you.
Yeah. Am I still sharing my screen?
No,
you see
the
the
screen
slides?
sharing has stopped.
Okay, sorry everyone, 1 second. No. That's not super helpful. Oh, here we go. All right, what am I sharing?
Natalie, we can see the presentation. If you, yeah, perfect.
Are we good?
Thank you
Okay.
so much.
Sorry. All right. Okay, so what was I saying? Sorry, I guess you missed everything. It's really good to be here, really great to share some of the findings from Writing Themselves In For with everyone. I'm going to be presenting a kind of a bit of a whirlwind of the Writing Themselves In For findings. So Writing Themselves In was a national online survey of LGBTIQA+ young people in Australia who are aged 14 to 21 years old. The survey was developed working closely with a diverse group of sector experts plus 2 youth advisory groups. It was promoted via social media and community and youth organisations, and it was open to responses in late 2019, so just prior to the pandemic. The survey included a wide range of questions about physical and mental health, as well as experiences of discrimination and harassment, connection to community, support from family and friends, and education-based experiences. So Writing Themselves In For is the largest ever survey of LGBTQA young people in Australia. We had 6,418 responses. But more important than being just large, it's also really diverse. So we heard from large samples of young people in rural areas, people from culturally and linguistically diverse backgrounds, those living with disability, and also a really diverse range of voices across the spectrum of gender identity and sexuality. And this allowed us to explore health and wellbeing experiences across diverse intersections of the community. And all those characteristics and intersections really matter. So the LGBTQA community is as diverse as any other population, and it's really important to consider that diversity when planning programs and designing services. So I'd like to present now a bit of a kind of a cross-section of the key findings, particularly as they relate to mental health and experiences of discrimination and harassment. But all of these findings can be seen in more detail in the Writing Themselves In For national report, which is available on the Archers website through the Trojans. Looking first at psychological distress, we measured this through the K10, which is a standardized scale for psychological distress. And we found that 81% of our participants displayed signs of high or very high psychological distress. And this was even higher among young people living with a disability, those who are trans and gender diverse, and those living in rural areas. And that figure of 81% is 4 times higher than the equivalent assessment that's been made of young people in the general population. Of serious concern was our findings that 1 in 4 LGBTQA young people had attempted suicide at some point in their lives. So that's 25%, a quarter of the young people. 1 in 10 young people had attempted suicide in the last 12 months. And this is a rate that's at least 3 times higher than is observed within studies of young people in the general population. And as high as these figures are to begin with, they were even higher among certain groups. So the experience of attempting suicide was significantly more common among those aged 14 to 17 compared to 18 to 21-year-olds, which indicates maybe particular exposure to harm among school-aged young people and those still more likely to be living at home. It's also much more common among those who are trans or gender diverse, where we saw 1 in 6 having attempted suicide in the last 12 months. We also found that 1 in 7 young people living in rural or remote areas had attempted suicide in the last 12 months, which was nearly twice as high as the proportion living in capital cities who had this experience. And similar patterns as well among those young people with a disability. So as you reflect on these mental health statistics, it's really essential that you hold in your mind the kind of environment that many young LGBTQA people still inhabit. And we heard from survey participants, almost 41% experienced verbal harassment specifically related to their sexuality or gender identity in the past 12 months. 23% experienced sexual harassment or assault, and almost 10% experienced physical harassment or assault in the past 12 months. And all of these figures were much higher for participants who are trans or gender diverse. And then we also saw that this challenge is particularly evident in educational settings, so at schools, TAFEs and universities. These have been sites of a lot of work over the last decade, but also sites of a lot of debate. But the data from Writing Themselves in 4 tells us that there is still a great deal of work ahead of us. And we saw 60% of those at secondary school told us that they had felt unsafe or uncomfortable in the past 12 months because of their sexuality or gender identity. And although the proportions were much lower, still we found 34% of those at TAFE and 29% of those at university reported a similar experience. We also saw that nearly 2/3 reported frequently hearing negative remarks regarding sexuality at their school in the past 12 months. And these experiences were even more common among those living in a rural or remote location. And we see from the data that this is very real and very recent experiences of stigma and violence for these young people, which tells us just how far we still have to go in tackling homophobia and biphobia and transphobia and any other hostility directed towards LGBTQA young people. So beyond the descriptive data that I've just presented, which is all in the national report, we've also been working with the Writing Themselves in 4 data to conduct some more kind of nuanced analyses, particularly looking at factors that are associated with mental health and wellbeing outcomes and can potentially serve as risk or protective factors for these experiences. So I wanted to share a little bit of what we've found to date that we've been looking at. So looking specifically at suicide attempt and suicidal ideation in the past year, we found that those of a younger age, so the 14 to 17-year-olds, and trans and gender diverse young people were at the greatest risk of suicidal experiences, which reflects the difference that we see in the descriptive data as well. We also observed, unsurprisingly, that young people who had experienced verbal, physical, or sexual harassment based on their LGBTQ identity were substantially more likely to have attempted suicide in the past year. And those who felt that they had been treated unfairly or socially excluded based on their LGBTQ identity were more likely to have experienced suicidal ideation. This is fairly consistent in the analyses that we ran, that those experiences within the environments that these young people inhabit are really the strongest predictor of their mental health and well-being. We have also identified some protective factors as well. So from previous research and some preliminary data analyses that we've run with the Writing Themselves in 4 data, we know of a number of factors that are important for protecting the mental health of young LGBTQA people. These include things like feeling close to people in their education institution, feeling happy to be at their education institution, and feeling connected to LGBTQ community or participating in community events. Also importantly, we've done some recent analyses looking at experiences of affirming education in workplace environments. So that looked at whether young people felt sort of safe and comfortable to identify or express their gender or their sexual orientation in these environments. And we found that those that were in an affirming environment, whether education or workplace, not only had lower levels of psychological distress, but also greater levels of subjective happiness. And that was true for both cisgender and trans and gender diverse young people. These findings that I presented aren't necessarily new. They replicate findings in previous studies as well and confirm much of what many working within the community already know. However, they tell the story with a much larger and more diverse sample than we've ever had the opportunity before to look at, especially with breakdowns by diverse sexual orientations and gender identities and different intersections of the population. In the National Writing Themselves in For report, we make 21 recommendations for action at the end of the report. And these include targeted interventions, national networks and forums for sharing of emerging good practice in addressing mental health among young people, as well as clearer expectations placed on mental health services to ensure that they are safe and affirming of LGBTQA young people so that they can get the help that they need if and when they reach out. Finally, I want to just quickly take a moment to thank those that made the Writing Themselves in For project possible. So that's our funders, as well as the very incredible research team from Archers, who was also supported by a very passionate and expert community stakeholder group, as well as a dedicated group of LGBTQA young people who worked with the team to ensure that the project was engaging, safe and affirming. And also a shout out to the thousands of young people that told their stories to us. Thank you.
Natalie, thank you so much for that. Really, the report itself is extensive and you've summarised it really well. Really appreciate you taking the time to do that for us this afternoon, but also recognising it's just not just about data, it's also about how we use this data, how we learn, and bringing in those protective factors and making some recommendations for change. I will say to our audience, a reminder that you can ask questions at any point through the go-to chat box or question box that should be on your screen. So we will move to our next speaker, but if you do have any questions, please put them in that box and we will collect them. So our next speaker I'd like to introduce is Jeremy Wiggins. Jeremy Wiggins uses he, him pronouns and is CEO of Transgender Australia, the largest national charity working to support families and carers of transgender children and young people. He was a 2016 Churchill Fellow in Transgender Health and is dedicated to empowering people of lived experience to be engaged at every level of service design and delivery. Jeremy.
Hello, thank you for having me. Can you hear me okay?
We can hear you perfectly, thank you.
Great, thank you. I'm not going to share my screen or a presentation. I'm going to just speak to our experiences in working with community. But first, I just want to acknowledge that I'm presenting to you from Dja Dja Wurrung country in central Victoria and pay my respects to elders past and present and any First Nations people attending this webinar today. And thank you for the invitation. Thank you for the introduction. I'm Jeremy, my pronouns are he and him, and I'm the CEO of Transgender Australia. We work to affirm the lives of trans and gender diverse and non-binary children and young people through supporting their families and caregivers. We are currently, if you've been watching the news, experiencing an intense time right now with coordinated attacks and public events impacting our communities. And I think it's really important when we are learning about what's impacting trans young people today through the research and through our practice experience is that it is a volatile time, and during these times our communities can experience increased rates of distress, violence and harassment. I just want to acknowledge that. We do work with communities in terms of providing individualised support and group support and providing education and information resources to families, particularly around referrals to multidisciplinary care pathways for young people. And I might just start by giving an overview about what the care pathway looks like for young people in Australia, and to speak to some of the protective factors, including family support, but also what some of the problems are in terms of the requirement for further legislative reform to enable better access to care, which is currently an issue for transgender diverse young people in Australia. So in Australia and across the world, it's estimated about 2 to 3% of young people identify as transgender diverse. And the numbers of trans young people seeking support and seeking access to services is increasing, but this is attributed to a growing acceptance from parents, doctors and peers, and also increasing media visibility, social policy improvements, and some level of protection in anti-discrimination legislation. It's created a more supportive environment for young people to disclose their feelings and to seek support. But trans people have always existed in these lands. When we do an acknowledgement of country, we also want to respect that we live on lands of the longest continuous living culture in the world, and there has been references to trans and gender diverse First Nations people existing in Aboriginal communities for many, many years. So that's an amazing thing that we have such a long history here in this country of gender diversity. So it's not a new concept, but it is becoming safer and people are becoming more informed to be able to speak up about it. The model of gender affirming medical care for trans young people in Australia is broken into stages. For those who don't know, I'll just provide a bit of an overview. If someone is under the age of 18 and seeking medical intervention, stage 1 therapy would involve puberty suppression with puberty blockers. And stage 2 is gender affirming hormone therapy, or referred to as cross-sex hormones. For a young person under the age of 18, it is a requirement under Australian law set by a precedent in the Family Court of Australia that both legal guardians or both parents need to provide consent alongside with the medical practitioner. Where that causes concern, and why I raise this in this session, is because it has practice implications for anyone working with families or young people, is that sometimes there are family disputes, and if there is an opposing or unsupportive parent, then an application to the family court is required to be able to get access to treatment. That does not include South Australia, that has GILIC competency enshrined into law, and Queensland also had a recent case that set a new precedent locally for Queensland that enables better access. But otherwise, there's a legal case called Re-Imogen in 2020 that deems that both parents need to consent. Now, this is actually considered medical consent discrimination for trans young people, because this is the only special therapeutic treatment where a young person would require both parents to consent. Many other medical procedures, one parent and a medical provider providing the assessment is sufficient for a medical procedure to continue. So young people are experiencing systemic barriers with the law in place here in terms of accessing treatment. And in the case of where there is an opposing or an unsupportive parent, particularly if they are a perpetrator of family violence, or if they have no connection with the family or the child and have an intervention order against them, or are not paying child support, they still have to be found by the medical providers to seek consent. So this is an area that requires further work, and it also is an area to be aware of, in terms of a family therapy or process that the young person's needs need to be met, and requires a range of action at a number of levels. In terms of the role of family support, it is seen as a huge protective factor for young people. We do get many inquiries every week from families and parents who are looking to access information and support for their young people. Some of the things that come through in terms of the challenges that families and young people are experiencing align with the research around what the risk factors are, and that is related to stigma and discrimination, but also homelessness, bullying and harassment. And almost half of trans and gender diverse people aged 14 to 25 have reported that they have attempted suicide in their lifetime. These risk factors lead to high incidence of poor mental health. So to be able to prevent these, we need an increased to increase the capacity and capability of the service system across the country to better respond to the needs of trans, diverse, non-binary young people and their families, particularly those living in regional and rural areas. The majority of gender-affirming healthcare services that have the training and the skills and the funding exist in metropolitan areas. We do support a number of rural-based families who do report extreme isolation and disconnection from community. So it's an important role to be able to meet the needs of people in rural and regional areas. In terms of the work that we're doing at the moment to support transgender diverse young people, particularly in times of heightened distress when there is public debates, such as what we've been experiencing recently or last year during the religious discrimination bill. We're seeing trends in Australia similar to the USA and the UK around looking to stop access to treatment. What we're doing to support transgender diverse young people is connect them to their peers and to support them through their protective factors, which is about getting engaged and amplifying their voices through leadership. So if you are working in a space where you're wanting to collaborate with an organisation like us, we would welcome that in terms of amplifying the voices of trans young people, because it is seen as a big protective factor. Some of the recommendations, and I'm happy to circulate this through to the organisers, policy paper that I launched at Parliament House late last year around the critical role of family support, and some of the recommendations linked to that would be for Australian state and territory governments to provide appropriate funding to community-led trans family support organisations to meet the growing demand. We have a wait list of over 200 families looking for support, and that is growing. So there are young people across the country who are not getting their needs met currently. There are workforce gaps in training, capacity building. There's accessibility issues related to gender-affirming medications that are not listed on the PBS. Young people can only get stage 1 treatment puberty blockers through the hospital-based system. If they have to go through a private route, it costs in the vicinity of $6,000, which is not accessible for all families. And just on a final note, the importance of raising awareness about these barriers, particularly the need to change the law to stop medical consent discrimination for trans young people. And when we consider gender-affirming healthcare for trans young people, we consider it to be life-saving. And then when people have access to timely care, when young people have family support, when young people have a safe education environment and a positive peer group, research suggests that the poor health outcomes can be almost ameliorated by those protective factors. So an investment in those protective factors is the way forward to ensure that trans and gender diverse and non-binary young Australians fare better long term in their lives. Thank you.
Jeremy, thank you so much for putting forward that important real life analysis from the data and making it clear what is currently facing young people. We're now going to go to a panel conversation. So if I can ask all of our panelists today to turn on their cameras. Joining Jeremy and Natalie in conversation is Olivia Stewart. Olivia Stewart uses she, her pronouns and is a real life young person. Thank you for taking the time to join our conversation today. She's currently studying software engineering and finds it important to share her experience about being trans. And her speaking events have included speaking at Parliament House as she strives for a more accepting world for trans youth. And I think everything that Jeremy has just said at that end about raising awareness is part of the reason we're having this conversation today, and we welcome Olivia. Olivia, if you could just take 2 minutes to introduce yourself before we throw to questions, that would be fantastic. Thank you.
Sure, just checking. Can you guys hear me all right?
We can, thank you.
So I'm Olivia. I'm currently 19 and at university. And I'm a trans woman. I came out 6 years ago, so it's been a while. And through that time, we've seen a pretty monumental shift in discourse around trans people and I guess the actual attention trans people get in society. So throughout my journey, I've kind of seen every side of what it's like being a trans young person as the times have changed a lot. And I'm just really happy to share my experience and try to raise awareness to a lot of the issues that face trans people, especially trans youth at the moment.
Fabulous. Thank you, Olivia, for joining us today. Now, we've got quite a few questions coming in through the question box, so thank you to our audience for putting them in there. I'm going to jump, I think, to the first question. Natalie, was directed at you, but I think everybody can maybe have something to say about this, about what did the evidence show us were the main variables around youth more at risk? So you talked about some protective behaviours or protective indicators such as connection to community and connection to school. Were there any others that we can actually respond and build on in our policy approaches?
Yeah, so the analyses that we've done now looking at those kind of risk and protective factors, there are certainly some things we can't change. For the individual, can't change things like their sexual orientation, their gender. We see worse mental health outcomes for young trans and gender diverse people. We see worse mental health outcomes for those that are bi+ compared to gay or lesbian. Younger age, as I said in the presentation, but I think the thing that is most clear and consistent across any analyses that we do is how they are treated. It's discrimination, harassment, it's discrimination in healthcare settings, it's discrimination at school, in workplace environments that really impact poor mental health. And then we see the reverse of that, which is that those environments, if they are affirming, if they are supportive and validating of their identities, really lead to better mental health outcomes, lead to greater subjective happiness for young people. So there's a lot we can do, there's a lot we need to do, and there's a lot of room to move here on providing affirming environments in healthcare, in education, in general environments. And we've run some recent, I'm just running some analyses actually the last couple of days looking at access to gender affirming care for trans and gender diverse young people. So looking at social affirmation, medical affirmation, legal affirmation, and we see better mental health outcomes for those young people who wanted those forms of affirmation, who did manage to access it, but we see even better mental health outcomes if they were supported to access it. So if they weren't denied or delayed or controlled their access to those forms of gender affirmation, there are significantly better mental health outcomes, less homelessness, greater happiness.
May I add something on to your point about discrimination, if that's all right? In my experience, discrimination also doesn't have to be direct and directly addressed to the person, but just being in an environment where you're hearing, say, jokes or discussions that probably aren't the most supportive can add up and really create a sense of stress. And just being in an environment where you have to worry about that, even if it's not, say, happening every day, where when you're making job applications, something I'm going through at the moment, and you have to think, should I tell them I'm trans, you know? Do I want to have a bigger chance of employment? And so that is something that adds up, even if it's not a direct instance of discrimination against you.
That's a good insight there, Olivia. The discrimination isn't always direct, but it is unfortunately present in more places than we might recognise. In terms of that, Olivia, if you had the opportunity to talk to the Prime Minister for 2 minutes, what do you think you would tell the Prime Minister in terms of what needs to change?
Well, I don't really think 2 minutes would be enough to consider all the change that needs to happen with the way trans people can achieve rights in Australia. But I think the main thing is to talk to the Prime Minister about keeping his ear open to trans people. It's a topic and I guess I can say a debate around trans issues that is often incredibly dominated by people who aren't trans and who have limited experience with trans people, especially in politics. Very few trans politicians, but a lot of politicians who aren't trans do want to legislate and do want to really affect the way trans people live their lives. So I think I'd really try to convey that there is an importance to always having a authentic voice of someone who does have the lived experience of being trans, especially in a world that's so polarized and with a topic that's constantly getting new information found in terms of statistics and that kind of thing, that it's important to listen beyond that and take the personal aspect rather than just a stance of numbers and data.
And
Thank
if
you,
I
Olivia.
could add to
Please,
that,
Jeremy. Yep.
after Olivia has developed a relationship with the Prime Minister, I would come in afterwards and thank the federal government for their $26 million investment into medical research funding with a specific stream that focuses on trans children, young people and young adults, and a 10-year LGBTIQ plus health and wellbeing action plan, which I know LGBTIQ Health Australia has advocated strongly for, and that's a welcome development. I think further around what's required is adequate inclusion of the needs of transgender diverse young people across all other strategies that impact young people, including families. So when I did a review of strategies when formulating this policy paper, our population was missing from all of these national action plans on youth and young people and health and wellbeing strategies for young people. And rather than a specific sort of strategy just addressing the needs of transgender and diverse people, I think we need to look at overall what are the mechanisms to ensure that we're included appropriately across all other populations, because we're not a homogenous group of people. And trans people also have other intersecting identities and experiences based on a range of socioeconomic factors or family background or newly arrived people, people living with disabilities, First Nations people. So we need to start to see consideration for specific population in these broader strategies. And from a policy perspective, that would be a great change in trickling down towards how services are provided, as well as when service agreements are being negotiated with state and federal governments, with organisations that provide services. We need to start to see inclusion of how services are being provided to minority and marginalised groups like transgender diverse people, and a way to measure the outcomes. So thanks, Olivia, for opening the door for me to say that to Prime Minister Albanese.
Thank you, Jeremy. Jeremy, we've had a few questions come through actually in relation to your presentation. And I think it builds on that answer that you just gave in terms of particular populations who are even more marginalised in being able to access services. So gender diverse people who are living in out-of-home care, or and those disputes that might happen between children and their parents, and how they might be able to, you already flagged it's very difficult to access services if there's a dispute between the parents, but in that point where there's a dispute between, well, the child isn't even living with the parents, what happens in those situations?
It's very challenging, but if essentially a child is under the care of the state, then the state has the authority to approve care. So I'm not aware of any situation where that's being denied, because the assessment process is trusted through the standards of care. So long as a multidisciplinary team of paediatricians, endocrinologists, clinical psychologists and psychiatrists have undertaken the assessment, and the patient or the young person meets the criteria of the standards of care, I don't believe that I know of a case where the state has refused access to treatment, because denying access to treatment would actually cause harm to the young person. So what young people experience when they're in not living at home in an out of care scenario is just further social isolation and disconnection from community. So if any other services are providing wraparound services or support to that young person, it would be about trying to put in place those positive factors around community support groups, activities, building up other elements of their lives to support their confidence and development, and acting as advocates for that young person in being able to navigate these complex systems, because it's not just access to the medical pathway. People might need access to, say, other garments that they might want to be wearing, or change of name certificates, or changing other personal records or details, or supporting them or engaging with school. So that's where it gets complex for people living out of home.
Great, thank you, Jeremy. I'm conscious that we haven't given ourselves the whole day to talk about this very important topic, so I'm going to throw one last question at you all. And Olivia, I'd like you to answer first, but what's the one thing, the reform that you just think should be so easy to do, relatively straightforward, but isn't happening? What's the one thing that we should just be able to pick up and do that would make your life easier and more fulfilling?
Well, that's a hard question. It's hard in the sense that nothing comes free, especially in politics and reforms. So if I'd rather say a reform that I'd want to see, and I think is definitely very achievable, is much more of a government financial assistance available to trans people, especially around medical and healthcare. So that involves things like more of a Medicare impact on, say, getting hormones and puberty blockers. I mean, hormones, you basically have to go to a private clinician, which can be very expensive and make it incredibly difficult for a lot of people to get hormones. On top of that, things like surgery aren't really covered by Medicare at all, and that can be hugely expensive. And I think it's a care that I see as essential as any other care that is offered through a government medical assistance. So I strongly believe that it is something that can be changed and should be changed, and I don't think it would be too much of a big deal in terms of the actual costs for the government in doing such a thing. So that's what I would say is the number one change I want to see at the moment
And,
is financial assistance.
Olivia, some people in the questions have also identified the need to roll more of these services into Medicare to make them easier access. So it's something that we can continue to talk to the government about. Natalie, what do you think we should do? One simple thing. Something has to be simple, right?
I mean, as I said, Writing Themselves in 4 has 21 recommendations at the end of the report. I don't know how to prioritize any one of those over another. I think Olivia's point is great. I think adding to that as well is just training in healthcare and for general practitioners to be able to provide affirming care in a mainstream service. That's not, you know, there's a lot of, we're LGBTQ friendly, but without actual knowledge and training and the ability to provide affirming care. I think that it should be more of an essential training in healthcare.
Great answer, Jeremy.
I'd agree with that. I think the biggest thing that's going to make an impact in the lives of young trans people is to not make them fight to access healthcare and to make it more accessible. So to remove the barriers. So that's going to require some amendments to Medicare to make sure that the medications are listed on the PBS for the purpose of our therapies and to increase the number of specialist services across the country, to open up telehealth options so that it's not required to have face-to-face appointments for people who live in rural areas who can't get the limited number of services. So just a small wish list there. But, you know, there's other models that have worked around like sexual health for people living in rural and regional areas that we can lean on, but we need to have an investment in increasing services and an investment in the evidence so that we can move away from what is used as an ideological argument for whether or not this care should be provided or not. And we need to consider this denying people access to healthcare as a denial of their right, and we need the federal government to stand strong and firm with us in that.
Thank you, Jeremy. Thank you, Olivia. Thank you, Natalie. I'm looking at some of the other comments that have come through, and I think as we acknowledged, and certainly Jeremy, you did too, it's been a very difficult few weeks for LGBTQI communities in Australia, and the conversations that we need to have to shift to remove this discrimination from our discourse is no more prevalent than right now. It needs to happen now. And coming at a rights perspective is the recognition that everybody has human rights, and those rights deserve to be accessed and lived. But I'd also like to acknowledge that there's been some great work happening here in the ACT, nearly 20 years after it was first mooted, the recognition that intersex young people shouldn't be forced to have conversion surgery if that is not right for them. A real groundbreaking moment. It's taken a while, but hopefully, having now had that pass in the ACT, we can see it pass in other jurisdictions. And again, recognise the human rights and the bodily autonomy of our communities. I would like just to repeat, as I did at the beginning, that if any of this conversation has caused you distress, or of the particular things that are happening in our world have caused you distress, please reach out to QLife by calling 1800 184 527. QLife also have a web chat service, which you can access by visiting qlife.org.au. And if you are in crisis at any point, Lifeline is available 24/7. Phone 131114. Look at a web chat from their website at www.lifeline.org.au, or text via your phone 0477 131114. A big thank you again to Natalie, Jeremy and Olivia. Your insights have been invaluable, and I hope these discussions contribute to understanding and support for young people in our community. We look forward to taking forward the recommendations from the report, Natalie, that you have been involved in writing themselves in and having more voices and less discrimination in our community. ARACY continues to hold webinars on a range of topics, and in the coming weeks we'll be talking about how governments measure wellbeing and how data is changing policy and practice. So we've had a real life experience here, and we'll be talking about the more general in a couple of weeks' time. You can subscribe to our e-bulletin at www.aracy.org.au for more information about these conversations and our continuing work. Again, thank you all for joining us this afternoon, and we look forward to connecting with you in the future.
Thanks.
Thank you.